So, people living in England and Wales are being urged to download the government's contact tracing app following its official release. NHS COVID-19 instructs users to self-isolate for 14 days if it detects that they were nearby someone who has the virus. It also has a check-in scanner to alert owners if a venue they visited is found to be an outbreak hotspot. But will people download it? Let's speak to Caroline Wiertz, who's the author of a study that examined how likely people are to use the NHS app. Caroline, afternoon to you.
Hi Ian. Thanks for having me.
It's a pleasure. Nice to have you with us. And I'm looking at my phone. My app store was winking at me this morning saying, come on, baby, download me. And I didn't. I don't know why I didn't. I guess that's perhaps with any app where you think, hang on, information, private details, sharing information, health, COVID. Unlike any other app, I'm hesitant. Am I normal?
I think you are not normal according to our study.
Okay.
but obviously we did this study actually a while ago. So we did it in May when we first of all, we were still in lockdown. And secondly, we also still thought it was the original NHS app that we were supposed to get much earlier, right? So things have changed. But at the time, people were actually quite willing to download this app. And the reason why we found, is because they were actually afraid of COVID. And they wanted to get out of lockdown. So I think that has something to do with it. It's like, what threat level do you actually perceive?
Sure.
The second thing, though, is that the app that they're releasing now is much better than the one they had originally planned. So in terms of privacy, they really have chosen the option that shares the least possible amount of data.
Yeah.
And if anybody is concerned that the government is going to basically track your data and is going to track you around through this app, they are not going to do that. It's not possible for them to do that. So from a privacy perspective, This app is actually really quite good.
So I'm not going to come home and find Matt Hancock sitting at my dining room table with a clipboard asking me if I've done.
You will not, no. You won't even find a human contact tracer get in touch with you. So the app is really set up in a way that the data stays within its ecosystem, and it will actually not share any data unless you have had a positive test or you have been notified that you that you might be at risk.
One thing I did notice, speaking seriously, I simply haven't had time to yet download it, but Ricky, our producer, did download it. It looks pretty simple. It's quite kind of idiot-proof, as it were.
It is, yeah. It's very simple. I must tell you that I haven't downloaded it, which is terrible because I'm probably one of the most motivated people to do it, but I can't because my iPhone is too old.
Yes, so, anything after an iPhone 6, is that right, will work.
Exactly, yeah. So iPhone 6 will work. Anything after iPhone 6 will work, and because you need the latest version of Bluetooth, which I, for example, don't have.
Yeah.
And there are some other restrictions that a certain tech setup simply won't work for you, which is of course a pity because that immediately excludes quite a large proportion of the population who might want to download it, but they actually can't.
So say that again. The other part of the population who haven't done what?
So they would like to download it, but they cannot because they simply have the wrong phone. So
I see. Yes. So certain phones or certain ages of phones would preclude you from being able to. But most people theoretically could download it. How does it work then? So I put my details in, and that's it. Off I go. Right? I just set the little thing up, and if I happen to enter a workplace where someone has COVID symptoms and they've also downloaded the app and they've inputted into the app that they have COVID symptoms, then I will get a message explaining that.
Exactly. However, so first of all, you don't input a lot of details at all. So there's nothing about your name or anything like that you would indicate. So it's really just your postcode. So they ask for your postcode so they can monitor a little bit how the virus develops in real time on the ground. But other than that, they don't ask you any information. And you will also not get, so they have a risk assessment of whether or not you are actually likely to have been exposed. So the idea is that you must have been for 15 minutes within a 2-meter radius of somebody who actually has tested positive. Otherwise, you're probably not at risk.
I did notice as well, because one of the things I found quite cumbersome, even though it's not really, it's a first world problem, is going into bars or gyms or places and being asked to fill out the track and trace form. This app comes with a QR reader, which I think can address all of that, right?
Exactly. So they give the option that it's something you can choose to use or not. So if you download the app, you don't automatically have to use it, but you can. So you can basically scan the QR code and then immediately the phone and the venue are linked.
Right.
So that if there is an outbreak, there is a way to track you again. But again, you can, if you want to delete that data at any point.
It's worth getting just so you don't have to fill out all those forms, isn't it, really? And that,
it is, exactly. It makes
for
it...
no other reason. The big question is this likely to work? And have we got any evidence of other countries using precisely the same technology where this has really been a game changer?
I don't think we have clear evidence yet that it works. We have theoretical evidence where a team at Oxford has modeled the likely impact of these apps in different scenarios. And while initially the argument was that you need at least 60% of the population to adopt this for it to really have a big impact, they have now basically revised this down. So even if only 10 or 15% of the population adopt this app, it can lead to an 8% reduction in the spread of the virus, which is better than nothing, right?
Sure.
So I think this is why Matt Hancock is saying, it's like the more people adopt it, the better. But it will have an impact even if not everybody adopts it.
So not a panacea, but it's part of the pie chart, as it were.
Exactly. So in Germany, I think almost 20 million people downloaded the app when they got it. And it's a similar app to ours. It doesn't do the QR code thing, but it does the other thing. And they've had hundreds of notifications sent out. But what exactly the impact is, I don't think they have the data to really know that yet.
Yeah. There's been a lot of money spent on this, hasn't there?
I assume so, yeah. But honestly, my point is anything we can do to help, to help live us a half normal life as safely as possible is probably worth doing it. Because again, just to emphasize the privacy concerns that existed with the previous app, they really have been addressed in this version of the app. And they have been very transparent about it. You can look at all the technical specifications on GitHub, so they're not hiding anything. And I would feel quite comfortable using this app.
Good to hear. Are you going to upgrade your iPhone though?
I probably need to get a new phone. I know.
Come on, you must be due for an upgrade after five years. iPhone
I know,
6 was
but I just hate technology. So
yeah, I get it. I get it.
Go.
Listen, Caroline, lovely to have you with us. Thank you, Caroline Wiertz, who's the author of the study that examined how likely people are to use the NHS app. 20 million in Germany downloaded it. Are you going to do it? I'm going to do it during the next break, I think. I'll do it. I'm going to give it a go. Oh, look, you see, Holly, who's another one of our producers, she's not sure about this. I don't know what she's expecting to hand. It's not Tinder, Holly. It's just an NHS app, all right? You haven't got to, if you swipe left, nothing's going to happen other than you're going to be able to register your name. There's the difference. But nonetheless, there are people who have privacy concerns. She just put that to bed, really, our last guest, Caroline, by saying actually all of that is covered. So don't worry about that side of things. This is just it's not going to solve coronavirus, but it's just another tool with which we can at least make a bit of a difference. Have you done it? And if you've done it, has anything already bleeped for you? If you've been down to the Greasy Spoon for a bacon doorstep and a nice cup of tea, only an hour later to get a message going, yeah, down there at Fred's Butties, you do realise, filthy down there, filthy, contaminated. I don't think it says that either on the app, but you take my point. If you've had any kind of message, I'd just be intrigued to see if that, if that genuinely kind of, I know it does work because they've tried it. It'd be intriguing to see if anybody's had that experience. If, however, you're absolutely not going to download it, why is the question?